Pediatric hernia and anesthesia. Patient age is 5 year to 6 year. Ever wonder how anesthesia is safely managed for toddler during surgery? Let's take a quick look inside the OR. Today we have a little patient undergoing a hernia repair. We have just administered the induction medicine and passed the face mask to ventilate the patient. For this procedure we are optioning for spontaneous anesthesia, meaning the child will breathe easily on her own. With the anesthesia stable, our surgeon is scrubbed and ready, the incision is made and the hernia repair is smoothly and successfully completed. And look at that. The baby is successfully waking up from anesthesia. We instantly turn into the lateral position. The crucial step prevents any risk of vomiting or aspiration as she recovers. Everything went perfectly. Don't forget to like and subscribe for more medical insights. Thank you.